Pulmonary ventilation is also known as breathing. It is a mechanical process that involves skeletal muscles changing the volume of the thoracic cavity. The lungs will follow changes in volume of the thoracic cavity because they are attached to the internal surface of the cavity by the pleural membrane. There are two phases to ventilation: inspiration, which is inhalation, and expiration, which is exhalation. These can be either quiet or forced. Quiet inspiration and quiet expiration occur while at rest to maintain normal breathing, while forced inspiration and forced expiration occur during exercise, physical activity, or as a result of chronic obstructive pulmonary disorders. During quiet inspiration, the diaphragm contracts and flattens, in addition to contraction of the external intercostals, which elevate the ribs. Since both of these are muscle contractions, they are active processes and function to increase the volume in the thoracic cavity, and the lungs expand as a result. This expansion creates a decrease in pressure. When the pressure decreases, this creates airflow into the lungs, as air has a tendency to flow from regions of high pressure to regions of low pressure. Quiet expiration involves relaxation of the diaphragm muscle, which returns it to a dome shape. The external intercostals also relax, which depress the ribs. As both of these involve relaxation of muscles, quiet expiration is a passive process. The pressure increases when the volume of the lungs decrease, which creates airflow out of the lungs. Forced inspiration, which occurs during physical activity, exercise, or when chronic obstructive pulmonary disorders are present, the diaphragm and external intercostals contract, just the same as with quiet inspiration. However, the serratus anterior muscles and the sternocleidomastoid muscles are also recruited to contract. The external intercostals, serratus anterior, and sternocleidomastoid all help to elevate the ribs and increase the thoracic cavity volume. Again, when the volume increases, the pressure within the lungs decreases, which creates airflow into the lungs. Forced expiration involves contraction of the internal intercostal muscles, external oblique, internal oblique, as well as the rectus abdominis muscles, all of which lower or depress the ribs to decrease thoracic cavity volume. In addition, the diaphragm relaxes and returns to its dome shape, along with relaxation of the external intercostals. The resulting actions decrease the volume of the thoracic cage, which increases the pressure within the cavities and within the lungs, which forces air out. The muscles of inspiration are shown on the left, with the muscles of expiration shown on the right. The diaphragm and external intercostals are involved with quiet inspiration and quiet expiration, while all others are involved in either forced inspiration or forced expiration. The changes in volume that occur during pulmonary ventilation create pressure changes, and those pressure changes create airflow either into or out of the lungs. This phenomenon has been described by Boyles' law, which is a principle in physiology and physics that mathematically shows that pressure and volume are inversely related to one another. Inversely related means that if one value goes up, so for instance, if volume increases, then the other variable must decrease. So in this example, that would be pressure. Airflow is driven by differences in pressure. It flows from regions of high pressure to regions of low pressure. When the respiratory muscles create increases in volume, that serves to decrease the pressure inside of the thoracic cavity and in the lungs, which creates airflow into the alveoli from the air that's in the atmosphere. When the respiratory muscles create decreases in volume, that increases the pressure inside of the thoracic cavity and inside of the lungs, which creates airflow out of the alveoli and back into the atmosphere.